Hello, am I audible? Hello, Dr. Naila, how are you? Hello, Dr. Hira. Okay, I think we have some new audience today. So let me introduce myself. I am Dr. Sambali Jas, Senior Lead Mentor at Instutors. So welcome from us. So we were receiving many queries regarding how we can start our preparation for MRCG Part 1. So what our team has decided to do a session on microbiology because it's a very important subject in the RCG curriculum. At the same time, it is very easy and very tricky, and you can easily ace all the SPAs from microbiology if you study the subject in a very smart way. So microbiology is vital in the RCG curriculum because it helps obstetricians and gynecologists to manage infections in pregnant women and those related to reproductive health. And it also ensures that one can diagnose and treat infections effectively, use antibiotics correctly, and understand preventive measures like vaccinations. So this is how this microbiology is important in terms of if we look at the subject from an obstetric or gynecological point of view. Additionally, it is essential for dealing with sexually transmitted infections, ensuring the health and safety of both mothers and the babies. So this is the importance of microbiology in the RCOG curriculum, and the points which I have mentioned, like what type of management we can do whenever it comes to a clinical practice, what is the application of this subject. And similarly, when you go and sit in the exam, you will see the questions from the microbiology in the same context. So we have listed out some high-yield topics from the microbiology. The purpose why we have listed high-yield topics is that we understand that there are many theory books. There is a lot of study material which is available on different platforms. So what are important points you need to extract from those pool of information or sets of books? So let me give you a brief. Like whenever, for instance, tomorrow you are going to start from microbiology. So what key points you need to keep in your mind while studying theory books, that you need to focus on the basic principles of microbiology. The benefit of studying this topic thoroughly is that you will be very crystal clear, or you would be well oriented regarding microbiology by studying basic principles of microbiology, like bacterial structure and function. What is the difference between gram-positive or gram-negative bacteria, and what makes them different, and what are the different examples? Then viral structure and its replication. So if you know these things, then you have a list of bacteria in your mind. So whenever you are going to study different infectious diseases, you are already familiar what type of organism causing this sickness. So excuse me for my cat, if you can hear. Okay, so the next thing, the next important thing you need to focus on is the vaccines and immunoprophylaxis. You need to focus on the vaccines which are relevant to the obs and gynae practice, like human papilloma virus vaccine, rubella, and hepatitis B vaccine. And classically in the exam, when you solve the exam like questions, you will see they frequently ask the questions from the vaccinations of HPV, rubella, and hepatitis B. So these are high yield topics. Then infections in pregnancy. You should have a list of infections which are prevalent during pregnancy. For example, if we talk about the bacterial infection, we have group B streptococcus, Listeria monocytogenes, Treponema pallidum, Chlamydia, and Neisseria gonorrhea. And I have highlighted Treponema pallidum, which is syphilis. It is a very high yield topic for this exam point of view, because literally they have questions from the structure of Treponema pallidum, its classification, different stages of syphilis, how you're going to manage that condition, and what is the interpretation of syphilis serology. So whenever you are studying syphilis, try to go through from each and every aspect of this topic, because this is very high yield topic. Then viral infections like rubella, CMV, herpes virus, varicella zoster virus, parvovirus, B19, Hep B, C, and HIV. So we have many questions in the recalls from these viral infections. And it seems like a lot, but honestly, they have just one question maybe from parvovirus B19, maybe one or two questions from HIV, or maybe one or two types of question from herpes simplex virus. So they have a similar set of information. What they usually do, they just twist around the question statement and a bit answer statement, so that you will not catch that this question is an old question. So this is how they regenerate their questions. However, the basic concept and the basic knowledge remains the same. Then when it comes to parasitic infections, you should be knowing Toxoplasmosis gondii, then fungal infections like Candida. Okay. So the other high yield topics from microbiology are perinatal and neonatal infections, and it mainly covers broad infections, which include toxoplasmosis, syphilis, parvovirus B19, rubella, CMV, and herpes simplex. Then sexually transmitted infections like bacterial STIs, chlamydia, the causative agents. Why I have mentioned the bacterial names? Because once you go through from the list of topics here, you will remain some of the information, and whenever you are solving SBS, maybe you already know this information that what are torch infections, what are the organisms, what are the most common organisms involving in STIs, and what are the bacterial microbes which are involved in viral STIs. So the causes of viral STIs would be human papillomavirus, herpes simplex, or maybe HIV. HIV is a high yield topic. When it comes to HIV, you need to study the guidelines, how we can manage a patient, a pregnant lady who have HIV, and how we can manage the baby who got birth from a HIV positive mother. Then we have pelvic inflammatory disease, UTIs, endometritis, and puerperal sepsis. Okay, so puerperal sepsis, you need to cover again the management guidelines, like how we can manage puerperal sepsis, what is the most common causative organism, and how we can proceed with the patient, and what type of preventive measures we can take in order to prevent puerperal sepsis to happen in a female. Then vaginal infections. And vaginal infections, we classically have three categories. It could be bacterial vaginosis, which is caused by Gardnerella vaginalis, candidiasis, which is a fungi, which is caused by Candida albicans. Then we have trichomoniasis, which is a parasite caused by Trichomonas vaginalis. So please keep these organisms and types of vaginal infections on your fingertips. Then you need to you should have a bit idea about emerging infections in the global health. So Zika virus and Ebola, these two viruses are emerging infections. Now you need to cover what is the classification of Zika virus, in which category it falls. Either it is DNA virus, either it is RNA virus. So you should have a basic idea about this. For the classification of virus, we have a table in which it is very easy for you to remember what virus is of what type. So it is not a big deal. Then we have Ebola and other viral hemorrhagic fevers and implications for pregnant women. Okay, sometimes in the exam, sometimes they ask about the percentages. Like if a mother have maybe rubella during pregnancy, so what are the chances of the newborn having congenital rubella? So you might get some such type of questions. Then laboratory diagnosis and management. Okay, in this domain, interpretation of hepatitis B serology is very important, and it's a bit tricky, but once you know the basics, then it is very easier for you to interpret any Hep B serology. Then what I have told you earlier, you might get a question on interpretation of syphilis serology. So these two serologies are very important. However, you need to have some basic understanding of culture, PCR, and antigen detection test. Then infections related to IUDs. And literally, in the recalls, there is only one question they frequently ask about copper T infection, like if a female have IUD, so what, and she developed an infection, so what is most likely causative organism? So if any one of you have any idea, please answer me in the chat box, or you can open up your mic. So if you want
actinomyces.
Yes, excellent. Okay, so did you know any other important point regarding actinomyces? Like what is actinomyces? Any idea? Is it bacteria or is it a virus? Yes, it is indeed a bacteria. So what type of histopathological findings, or what are the key points or morphological features of this bacteria, you can easily pick this out. For example, if there is a question that a female come to the gynecological OPD and she is complaining of fever, some vaginal discharge, and pelvic pain, and when you did microscopic examination, you found some of the findings like A, B, or C. So what is the most likely causative organisms? So do you have any idea what are those microscopic features which are classically associated with actinomyces? Yes, one plus. Okay, it would be better if you rename yourself. Yes, sulfur granules. Okay, the purpose why I'm highlighting this point, like in microbiology, sometimes you might get some question in which they give you some microscopic features, and then you have to find out the organism. For instance, in case of actinomyces, they might give you, they might don't give you any hint regarding IUD maybe. In that case, if you know the morphological features or microscopic features, that would be helpful for you to pick up the right organisms from the options. So actinomyces, yes, sulfur granules. It is classical with actinomyces, and it is the most common causative organism if a female presents with vaginal infection and she already had IUD. So you have done one XPA. Well done. Okay, so if anyone has any confusion regarding high yield topics, or if you want me to repeat any point, you can ask me. Otherwise, I will move on to the teaching topic, that is vaginitis. Okay, one more point. The purpose why I have given you the list of high yield topics is not that you can skip rest of the topics. This is not the right way. What I'm trying to do here is that once you're reading everything, I know we understand that it is not possible for anyone to remember all the theory lines or each and every topic. So if you know these points, if you know these topics, you should know that I have to give more time to these topics. I have to retain some of the important points from these topics. So this is the purpose of high yield topics, that you are confident in these topics. You should be 100% prepared in from the topics from this list. So these topics should be on your fingertips because many questions come from these topics in the recalls. Okay, so let's start a topic from which is a high yield topic from microbiology, which is vaginal infections. Also, it is termed as vaginitis. So classically, if we look at the prevalence, we have three further classifications which are based on the basis of causative organism. It might be bacterial vaginitis, it might be fungal, and it might be viral. It might be parasitic, bacterial, and fungal. Sorry. So these three types are the most common types of vaginitis. So anyone have any idea how we can differentiate one from other, or any idea if a patient comes with Trichomonas vaginalis, how would you diagnose that patient?
Patient will have intense.
Could you please repeat yourself?
Hello, can you hear me? Hello.
Yeah, I can hear you now.
Patient will have intense itching in the vagina with greenish discharge, and patient may have a pain, pelvic pain or may not, but she will have an intense itching in cases of vaginity.
Okay, excellent. That's perfect. Okay. I think I have many brilliant students this time. Okay, let me see your answers. Okay, Maheen, you replied that yellowish greenish discharge and strawberry cervix. Please tell me, you are talking about which type of vaginitis? Is it parasitic? Is it bacterial? Or is it fungal? Okay, let's compare. Okay, whenever it comes to a discharge, when we usually do our clinical practice, we ask, when we take the history from the patient, we usually ask the patient about the texture of the discharge, about the color, odor, and consistency sometimes, or the amount. Similarly, when we compare the vaginitis and we are taking history from the patient, and in this exam, since you are having a written exam, so what you're going to have in your exam, you will get a question in which a complete scenario would be given, like a patient come to the OPD and she's complaining about discharge, and these are the findings there, and then you check, and when you check the pH, these are the pH findings. So what would be the most likely organisms? So this is how they're going to ask the questions. However, let's compare. Vaginal yeast infection, which is also known as vaginal thrush, which is caused by candida. So it's a vaginal, it is a fungal vaginitis. So patient may have thick, white or curdy discharge. Color would be white. There would be no odor, and pH is usually in the normal range. And physical symptoms might be itching and burning. I will explain one by one, and then I will explain how you can easily pick one of the out and how you can easily diagnose. Okay, when it comes to bacterial vaginitis, the patient may complain of thin milky discharge, which may be white, off-white, or gray in color, fishy smell, and the pH would be greater than 4.5 and may have itching and burning. Then trichomoniasis, thin, foamy, frothy discharge, yellowish to greenish color, foul, moldy smell, pH again, it is greater than 4.7, and yes, there is itching, soreness, pain when urinating. So what are the common features? Okay, bacterial vaginitis, that is very easy to pick out. Yes, clue cells in bacterial vaginosis. So whenever in the question statement they have mentioned that we sent the discharge for the microscopy and it came back as having as clue cells, then definitely it would be bacterial vaginosis. It is classical. And what as the high yield point or the hint they will give you, the fishy smell, gray odor, clue cells. So these 3 points are the, you may say, the red points they will give you in the question statement so that you can pick bacterial vaginosis. And sometimes don't go with confused with the color, since the vaginal thrush also comes with a white color. So in that case, please tell me how you will differentiate bacterial vaginosis from yeast infection. If in both cases, the patient may present with white discharge and they didn't give you any clue regarding smell or odor.
There is no odor, whereas in bacterial vaginosis there is fishy odor.
Sorry, could you please repeat? Yes, pH is the right answer, because I have seen a question in which they haven't given any hint. They just mentioned the patient is complaining of white discharge and some pain and fever and everything, and they just give the hint of pH. So this is how, and this is why it is important to remember all the parameters so that you can easily differentiate vaginal infection, bacterial vaginosis, or trichomoniasis. Okay, when we talk about the trichomoniasis, it is parasitic. What is classical point? Yes, the pH is increased in both bacterial vaginosis and trichomoniasis. The difference you can compare by the color of discharge, or if that is not there, then you can compare it with the odor. because one is with fishy smell and the other one is foul moldy smell. And yes, there is another high yield point, which is strawberry cervix. So this is all about vaginitis. The next step, now you know how to diagnose the patient. So what is the management? Okay, in MRCG1, they don't expect from you to do consultant level management. They just want to assess that you know the basics of management. For example, in case of trichomoniasis, it's a kind of revision. Patient may present with frothy, offensive, smelly, yellowish-greenish discharge, vaginal itching, strawberry cervix. Vaginal pH would be more than 4.5. The treatment would be oral metronidazole. Please remember, the treatment, the management for trichomoniasis is oral metronidazole. Then how you will manage bacterial vaginosis. It is caused by the causative organism is Gardnerella vaginalis. Patient may present with thick gray white discharge, fishy, very offensive smell, loose cells, positive whiff test, which is potassium hydroxide test. It would also came back positive. pH is more than 4.5, and the treatment is again oral metronidazole plus oral clindamycin. These are the guidelines for the treatment of bacterial vaginosis. Then vulvovaginal candidiasis, which is caused by Candida albicans, which is also known as vaginal thrush. Patient might present with thick white teeth-like discharge, odorless, vaginal itching, pH would be normal, and the treatment is topical clotrimazole or oral fluconazole. And if in the exam you will find the options of IV clotrimazole or IV fluconazole, so please exclude those options because the first line of treatment or the management of vulvovaginal candidiasis is topical clotrimazole. Or if that is not in the option, then oral fluconazole. So is everyone clear regarding the management and diagnosis or in the types of vaginitis? If anyone have any question, you may ask me. Okay, so should I start SPs? Thank you, Dr. Mahi. Okay. So I will give you only 45 seconds to answer these questions. And when I explain the explanation, I will tell you more important points which are relevant for the exam and how you can solve different SPAs. So here's your question. 16-year-old has recently become sexually active. She complains of intense, irritating, greenish, frothy vaginal discharge. The organism is seen under microscope in a drop of saline and the pH is 6. What is most likely causative organism? Okay, you have just 10 seconds left. Okay, excellent. D is the right answer. And why D is the right answer? Trichomoniasis, it's a kind of revision. Why I've mentioned again about this Trichomoniasis vaginalis. What I'm trying to make sure reflects is that once you read the theory, then you read the important points, the comparison table, and then you solve the SPAs. And when you solve the SPA, then again try to study about that topic. So this is how you can only just in one time you can revise the same amount of information 3 to 4 times maybe. And this is how you can retain all the high yield points and all the important SPAs or the recalls. And I think this is the right strategy to ace this exam, because uh, I don't think so that you can remember all the theory from Oxford or Essential Revision Guide. I don't think so anyone can retain that information. So again, try to remember, try to study for this exam in the right way, in the right direction, and smartly. So what is trichomoniasis? Again, who have missed the previous lecture, it is a protozoan parasite, which is known as Trichomonas vaginalis, commonly presents with frothy yellow-green vaginal discharge, strawberry cervix, along with itching, irritation, and a characteristic odor. So these are again the important points or the key points which they might give you in the question statement so that you can pick the right answer. Additionally, the parasite can be visualized under a microscope in a saline preparation of vaginal fluid, what they have mentioned in the question statement. The elevated pH of 6 also aligns with the diagnosis of trichomoniasis, as it is often associated with an increase in vaginal pH. So this is the correct explanation of this question. Okay, here is your next question, which is also from the recalls. A 28-year-old female presents to her gynecologist with complaints of vulvar itching and thick white vaginal discharge. She denies any urine symptoms. On examination, there is erythema of the vulva and a curd-like discharge in the vaginal wall. Vaginal pH is 4.5. What is most likely diagnosis? Okay, your time's up. Yes, excellent, everyone. B is the right answer. Okay, your next question is, this is the picture of which organism? Don't worry, make a guess. This is a question which I got in my exam. Okay, your time's up. Okay, I need a volunteer who can explain me why B is the right answer, because all of you go with the option B, and I think Dr. Eliza, Dr. Meena, and let me check. Okay, so these two go with the option A and rest of the students go with the option B. So I need a volunteer who can explain me why A is the right answer and one volunteer why B is the right answer. Okay, one plus, could you please tell me your name? Please write in the chat box so that I can address you in a better way. Okay, what is undulating membrane? Any idea what is undulating membrane? I want to see your concepts. Okay, undulating membrane is basically a thick part of cytoplasm of this microorganism cell, which is, yes, B. No, it is not mitochondria. It's cytoplasm. It's a thick band of cytoplasm, you can see. Okay, yes, Trichomonas vaginalis. And yes, many of you were right that we go with Trichomonas vaginalis. We know that it's a parasite because of flagella. Okay, this is uh, this is a demo. That's such kind of questions you will get in your exam. There are many questions in anatomy, maybe some questions in clinical management or in different modules where you will get a picture and you need to do a spot diagnosis, or maybe they will give you and ask you identify the structure, or they have different variants of such questions. But keep in your mind, and yes, you might get some ultrasound pictures and chest x-ray as well. And then you need to do spot diagnosis. And this is a demo question. And in microbiology, you might get such slides maybe, and you need to identify the microorganisms. So, and how you can identify microorganisms, if you know some basic structure regarding different organisms, I don't recommend you to go and study all the morphological features of all the bacteria or microorganisms. Only those who are important and high yield in terms of exams, like this this parasite, Trichomonas vaginalis. And this is the picture. This is the question I will get in. I got in my exam. So let's talk a bit about Trichomonas structure. I think this is the right way to teach you. If we solve the SPA, we do some brainstorming and then we understand the question and what is the context of that question, what is the explanation, and what was the purpose or the psyche of the examiner behind asking that question. So I think this is a good idea if you study this way. And why I'm showing you different techniques to study or solve SPA, so that when you start your preparation, you might follow them, and it would definitely help helpful for you. So let's talk a bit about Trichomonas structure. Then I will come back to this tips point. Then I will share you how these tips are beneficial for you and what are the different strategies you can follow to study for this exam. Okay, so Trichomonas, all we know, it's a parasite cell which is pear shaped and may have 4 flagella anteriorly. So it's a very easy point to find out because there are many variants for parasite, for Trichomonas vaginalis. But yes, it is important, if you find 4 flagella on the anterior spec, then go and blindly go with the option of Trichomonas vaginalis. Then what are the other features? Yes, it has a fifth bordering the undulating membrane, and this undulating membrane here you can see. This is an undulating membrane. A mouth and a basal rod are found along the membrane, and exostyle, which is a stiff rod of cytoplasm used for support. Okay, let me correct myself. Undulating membrane, I was actually talking about exostyle, and I a bit confused with undulating membrane. However, the exostyle, it is a structure which is a stiff rod of cytoplasm, which is, you can see here, And if you notice its location, it is mainly there for the support of this parasite, which often protrudes posteriorly. However, the purpose why I have shown you this picture, that this is how a trichomonas, a parasite, this parasite looks like, and only by looking at interior four flagella, you can easily pick out any picture. And now here is another tip. Once you find any question in which they have given some picture for any muscle, any parasite, any slide, or any pathology, try to make yourself familiar with other pictures as well. What and how you can do that? There are plenty of pictures available on the Google. For example, if I open up my slide, give me a second. Okay, trichomonas. This is how you can follow. Try to make your reflexes like that. For example, yes, today you will see a picture, a question of Trichomonas vaginalis. Now, what would be your next step? Now you know the basic structure, then go on the Google and try to make yourself familiar with different types of pictures. For example, yes, and try to identify the features. And what I have given you a tip, if you find 4 interior flagella, then yes, it is Trichomonas vaginalis. Let me, if you can see here clearly. Is this picture clear to everyone? Okay, good. Okay, let me show you some other pictures. This is a good picture, which is very colorful. However, you will not get this type of picture in your exam. Mostly they will give you the picture under normal saline or gram staining. So let me find some. Okay, this one is a bit tricky. However, this is again, it is pear-in shape. Okay, flagellas are not yet clear here. However, they would not give you such a missing picture. Okay, here again in gram staining, you can see how it is pear-shaped. It has undulating membrane exostyle and flagella anteriorly. So this is how you can do that. Again, this is gram staining. You can see flagella anteriorly, exostyle, undulating membrane. I think these pictures are more than enough. Again, this is gram staining. If it's visible to everyone, okay. Again, for flagella anteriorly, pear-shaped body, undulating membrane, exostyle. So coming back to our topic. So when we study when we do any other live session, maybe on embryology sometimes in future, then I will show you how you can look at different pictures of placenta, types of placental pathologies, and how you can do the spot diagnosis. Okay, so here is your next question. A 23-year-old woman presents with fishy, foul smelling vaginal odor. Flu cells are found in the smear. What is most likely causative organism? I think this one is the easiest question. And please pray you find this question in your exam. Okay, yes. C. Gardnerella vaginalis is the right answer. Okay, many of times we have heard about flu cells. So what are flu cells? Let me show you. Bacterial vaginosis caused by anaerobic bacteria such as bacteroids, I don't know how to pronounce that. However, remember the name. and gram-negative bacteria such as Gardnerella vaginalis. So these are the causative organisms. Okay, there is an SPA which I have got in my exam as well from the microbiology under the same topic. They have given a list of organisms. They have given a table, and they asked what are the bacterial organisms responsible for vaginosis. And at that time, when I was solving my exam, I was only familiar with the organism Gardnerella vaginalis. I had no idea, not even a 1% idea that bacteroids and this organism, it is also responsible for bacterial vaginosis. So please remember all the causative organisms, these three mainly. These are, if you find in the exam such question, and you don't find the option of Gardnerella vaginalis, then you can also go with bacteroids and this bacteria. I don't know how to pronounce that, but remember the name or the spellings. Okay, so these are the causative organisms for bacterial vaginosis. A white discharge with fishy odor and clue cells on microscope examination help to establish this diagnosis. So what are the clue cells? If you look at here, these are the vaginal cells. These are the bacteria, and on the surface, you can see on the epithelial surface, these are the clue cells. So on the microscopy, if you find such appearance, that is, these are the clue cells and it is positive for Gardnerella vaginalis. Am I clear? And I am still struggling to pronounce this bacteria, Mobilingus, I guess so. And you are, and everyone free to help me. If anyone want to contribute, participate, add some extra information that might I have skipped, or if you have your already some background knowledge and you want to share with your colleagues, you are more than welcome to help me. Okay. So I want to give you a gentle reminder that we are going to start our batch 2 for MRCG part 1 from 1st of August. And some of the features of our premium course, like what are the benefits you will get if you are our premium student. You will get a main schedule and mini schedule for all the modules in the RCG curriculum. Then you will have a live session Zoom link of each subject. Then you will also get the live session recordings, so that if by any chance you missed your live session, you can later on watch that video or lecture. Then we have all the books uploaded on the website. Then you will get subject-wise mocks, subject-wise recalls, which are very beneficial. For instance, if you have started your microbiology, you have done your theory, you have solved some SBs from different resources, and now you can practice subject-wise recalls as well. Then PDFs. PDFs are the lectures which you have received during the live session. So those lectures would be also available in the PDF form, and that would work as your mini notes or a quick revision notes as well, because these live sessions have important, these presentations have important high yield points. Then at the end, you will have 3 big mock exams as well. Okay, someone help me finally. Randeep, help me. It's Moby Linkus. Okay, got it.
Yes, it's
Okay, please. Okay, whatever. I'm very bad with pronunciation. I'm very, very bad. However, you need to remember all these 3 bacteria, because during my exam, I have no idea about these organisms. All I know was bacterial vaginosis. That was on my mind. And I think I marked that answer wrong. Okay, so for any technical support, you can contact us on our numbers or our Facebook page, or you can email us on info@medinstutors.com. And yes, we have an offer for you. We are offering our course, our premium course, in just $150 till 1st of August. So get your enrollment done now, or at least before 1st of August. I'm welcoming everyone, because I think we have a very good quality students this time. So I'm counting on you people. Okay, one more thing before I close today's session. If you have any questions, you can ask me. And I wanted to recap some tips like how you can solve the SPAs. So what I have done so far, I have show you some different questions from the topic. Okay, how you this is how you can follow module wise. For example, you have studied this topic, or you have studied microbiology, for instance, then go and solve the respective SPAs from that topic, and how you can solve different SPAs, how you can retain information. You may remember the highly important points which are maybe available as flashcards. You may make your own notes as well. So this is a flashcard. These are the small short notes we have made from this topic. We have extracted all the important high yield points just in one place so that it would save a lot of your time. There is no unnecessary information in this slide. So this is how you can also make your own notes on your book or any place or on your diary. Okay, this is one tip you can do. Another thing, yes, the pictures. For pictures or any identification pictures, either comes from the anatomy, radiology, pathology, or microbiology. Once you see a picture, then go on the Google and search different variants of that picture and make yourself familiar from the different appearance of that structure, so that if in the exam they will switch the picture, you will know how to diagnose that, and try to remember any key feature from that picture. For instance, in this picture, we have a shortcut that any structure which have 4 interior flagella, that would be a parasite, classically Trichomonas. And yes, there is another tip. You can solve the SPF first and then go and read the explanation, good quality explanation from any resources you are following. This way, this is also helpful for those who don't want to study too much theory, who have not enough time to study theory. So what they can do, they can start solving SPAs, and when it comes to the explanation, they can read the topic at that time. While studying the explanation, they can thoroughly study or cover that topic. So this is another way to study for this exam. However, this strategy sometimes makes you panic, because once you don't know the answer, you got panic that I'm not enough, I'm not feeling good enough, I'm not studying enough. But in this way, you will never ever forget your SPA, because we all study from our mistakes. So this is a good way to study for this exam. So these are some of the tips and tricks. Is everyone clear? Thank you so much, Dr. Hira. Welcome. Welcome, Dr. Andeep. Okay, Ranim, for now, there is no clinical experience needed to book MRCG2 exam. But yes, if you have clinical experience, that would be helpful, because in MRCG2, it is all about clinical management and the guidelines. So that would help you in studying for that exam. But classically, RCG didn't ask for any clinical experience. Like 4 to 5 years ago, they have this rule that if you have 2 years clinical experience, then you can sit in MRCG exam. But these days, they have exempt that rule. Now you can straight away, if you pass MRCG1 exam, then you can straight away book your MRCG2 exam. Okay, Samsung. Maybe I'm the lucky one. Okay, Mona, microbiology, honestly, it is very interesting subject because there are many mnemonics to study different structures of bacteria and virus and everything. Okay, Ranim, yes, you need 4 years clinical experience if you want to book MRCT3 exam. Okay, Mona, I'm glad to know that. Okay, I'm hoping I will see you again in the next session and what we can do. But you have to cooperate with us. You have to tell us in the group that from where you are starting your exam preparation, where are you standing? Are you starting from anatomy or are you following which module so that we can organize the free sessions according to that. And honestly, I'm excited to teach you endocrinology and embryology. Those are my favorite subjects. Okay, I think we have no more questions. Okay, thank you so much everyone for joining us today. It was a really fun discussion. And see you next time. Goodbye.